The iliacus and psoas major, together called the iliopsoas, are important hip flexors and low back stabilizers. The long, slender psoas major is located deep to the abdominal contents. It stretches from the lumbar vertebrae, underneath the inguinal ligament, to the lesser trochanter of the femur. The stockier iliacus is located deep to the abdomen in the iliac fossa. So before we access the psoas and iliacus, a few tips. First, anytime I explore down into the abdomen or even coming back out, I'm going to use nice slow movements and soft finger pads. Secondly, I'm going to note that the abdominal aorta passes right down the center of the abdomen, and if while I'm accessing I feel its pulse, I'm going to just bring my fingers out and just shift a little bit further laterally. And lastly, I'm going to let my partner know that if any time you feel uncomfortable and you wish to stop, you just let me know.
Okay.
So let's begin with the psoas major. And let's begin by first seeing it on the abdomen. And there we can see as it passes from the lumbar vertebrae diagonally down toward that lesser trochanter of the femur. So I know that it basically runs right here, but how can I sort of find a way to access it? Well, here's the way. I'm going to locate the ASIS, that prominent bony landmark on the front of the hips, and the umbilicus, or navel. Well, if I draw a line between these 2 points, right at the middle of that line, right there, is where I'm going to want to set my fingers to access some of the psoas major. So, right there along that line, and I'm going to just very slowly and softly work my fingers in. I'm going to encourage my partner to just take a few deep breaths. Take a few deep breaths. Great. And I'm going to use some nice sort of circles to sort of help move some of the intestines out of the way. And I'm working my fingers at an angle. I'm going in this direction, sort of toward the center line of the body. And I believe right about there, I'm at the level of the psoas. So what I'm going to ask my partner to do is just bring your knee toward your shoulder like a ½ an inch. So she's going to try to flex her hip. And sure enough, when she does that, right underneath my fingers is a real solid contraction. And go ahead and relax. And when she relaxes, my fingers sort of sink in a little more. Go ahead and contract. And when she, again, flexes her hip, this muscle engages, and my fingers actually kind of push out a little bit. And then as you relax, my fingers sink a little further in. So I know that I'm on a portion of the psoas major right there. And so I'm going to just slowly bring my fingers out, like so. So I can do pretty much the same thing a little bit further superior and a little bit further inferior, anywhere along that path of the psoas major. And that's a little idea of how you can access the psoas major in a supine position. But before we turn our partner sideline, let's take a look at the iliacus. So there we can see it as it lays in the iliac fossa right there. So the strategy for this muscle, because most of it's going to be pretty much inaccessible, is I'm going to try to scoop my fingers around the iliac crest. So I'm going to find that ASIS, that prominent landmark there, and here we have that iliac crest, and I'm just going to set my fingers right on the medial side of that iliac crest, right there. And for this, I'm just going to bring up my partner's thigh like so, and just holding on to it. And this softens up the tissue a lot more. And as my fingers slowly sink into this tissue, I'm going to ask my partner, go ahead and try to flex your hip a little, bringing your knee toward your shoulder. And wow, right underneath my fingers is a real solid contraction of this muscle that sits in that iliac fossa. Good, relax. And as she relaxes, my fingers sink in a little bit more as this muscle relaxes. Good. And I'm just going to slowly bring my fingers out like so. Great. And that's a great way we can access the iliacus in a supine position. So now let's turn our partner sideline and see what we can find there. So my partner's in a sideline position, and just for a moment, let's take a look again at where the psoas and the iliacus are. There's that psoas again coming from the lumbar vertebrae all the way down to attach to the femur. And there in that iliac fossa is the iliacus. Good. So the great thing about side-lying position is that the abdominal contents shift down toward the table. So what I'm going to do is pretty much the same thing we did when she was supine, is I'm going to locate those two landmarks, the ASIS right here and the umbilicus, and I'm just going to set my hand and my fingers right here along that line, and I'm going to very slowly work my fingers in, sort of following my partner's breath. And right about there, I feel as though I'm at the level of where the psoas might be. So I'm going to ask my partner, go ahead and just bring your knee again, just a pinch toward your shoulder. Great. And as she tries to flex the hip, right there, I can feel that muscle contract. And then go ahead and relax. And my fingers sink in a little bit deeper. You're doing okay?
Yeah.
Okay. And so we can access right along that line of the psoas here. I can even come up a little bit higher here, or even a little bit lower down in here, more in the iliac fossa. So for the iliacus, I've come around to the other side of the table, and I'm going to begin by locating that ASIS right there and walking my fingers back along that iliac crest. And then I'm just going to sink my fingers in a little medial to that, right into that tissue where the iliacus is. And what's great is that her hips are flexed, so all this tissue is shortened, and since she's side-lying, all the abdominal contents have fallen down toward the table a little bit. And there I can very slowly and easily work my fingers into that iliac fossa right there. And if you try to bring your knee toward your shoulder a little bit, great. And that muscle definitely engages, and then relax. And there it definitely softens. And I can really work my fingers along this iliac crest to access some of that iliacus. And that's just a little bit of how you can access the psoas and iliacus from a supine and side-lying position.